Hello, my well-being buddies. Welcome back to the Mental Health Nurse, and we're now going to look at substance misuse. So here, we're just going to look at what substance misuse is, what causes this, some of the risk factors. We're going to look at some of the signs and symptoms. We'll understand how it's assessed. We'll look at ways that we can support people with a natural approach, and then we'll look at some of the treatment options. So let's just start off by saying substance misuse is a global health concern. It affects millions of people worldwide. The exact number is not clear. However, there is an estimation done in 2021 from the National Office of Statistics, and it was estimated it affected around 275 million people aged 15 to 64 worldwide. And again, in 2020, they reckon it increased by 36%. And we obviously know why, due lockdown, etc. So the report on drug disorders looks at substance dependency, was estimated around 36.3 million people. An additional with alcohol estimated 3 million deaths each year are contributed to tobacco, whilst 8 million around substances. So that's a huge death rate worldwide. So what causes substance misuse? Well, the cause of substance misuse is quite complex from person to person. There's no single factor that takes into account for this disorder. However, there are some typical things that can be biological, psychological, and environmental factors. So we'll just run through some of those now. So genetics plays a part. There is evidence to suggest that certain genetic factors may increase a person's risk of developing substance use disorders, including genetic variations that affect the reward pathway of the brain. So that's to do with the dopamine levels, and that can then look at drugs and alcohol. Trauma or stress can affect people, and again, is a significant factor and stressor in people's lives. So people may become more vulnerable to substance whilst going through some traumatic periods, and they use it as a coping skill to dull or lower that emotional piece of work. There are certain mental health conditions where substance misuse is associated with, and that can be depression, anxiety, bipolar, PTSD, post-traumatic stress disorders. And again, that's all around that risk-taking behavior or impulsivity or just the lack of I don't care. And then there's some social and environmental factors. So again, the availability of drugs and alcohol within certain cultures and attitudes towards them. So this could be family members, this could be peer support. And again, it could just be, in your family and part of your upbringing. It's important to note that substance misuse is complex, and it is very much an individualized behavior, and not everyone experiences the same risks, and not everyone develops the same around substance or necessary addiction around the use of those. So we need to use very much a personal-centered approach. And it's really difficult to get people to identify this, and they need to be incredibly brave to do that first step into recovery. So substance misuse can be described, I guess, in the way where somebody is unable to not live without that certain substance, or they use the substance to an extreme. And what we mean by that is it can affect their physical health and they're unable to stop. It affects relationships and they're unable to stop. And it puts them in financial hardship or distress, or they prioritize that substance over everything else. And when we talk about substances, it's not just drugs and alcohol. Gaming, your phones can all be the same thing. So anything that rewards the dopamine in the brain that gives you this feeling of happiness can be seen as a substance. So it's important to realize there are many types here. So what are the risk factors? Well, if we're taking substances into the body, the risk factors are it can cause liver failure or liver damage. So the liver is one of those organs which is quite self-repairing, but it does need time off. And again, looking at ways of repairing your liver and just giving yourself time to detox is really important. The risks around substance misuse, I think, speaks for themselves. When somebody's under the influence of a substance, they're making poor decisions. So they're unable to think clearly, they put themselves more at risk, and there's a chance of self-neglect. So again, all of that happens. So what are the signs and symptoms here that we're looking for? Well, it really depends on factors such as age, gender, but overall, here are some common things to look for. So first of all, is there a change in somebody's behavior? Can you see a mood change? Are they becoming more irritable? Are they becoming depressed? Can you see anxiety kicking in? Are they changing their social behavior? Are they withdrawing from family members? And are they becoming more secretive? They may change their physical appearance. So this is about their personal hygiene, their upkeep. They may be experiencing some weight loss because, again, of that self-neglect. And you may see kind of dilations of the eyes or bloodshot eyes. You may see a change in the sleep pattern. So somebody's not sleeping as well. So with insomnia, or they're sleeping too much because they're having to go into that recovery phase. You may see a change in appetite. So again, it may increase or decrease. You may see physical symptoms, so nausea, vomiting, sweating, tremors, and seizures. And again, on that note, it's really important that if somebody is using a substance, that they never stop straight away. Stopping a substance cold turkey can actually cause the body to go into a shock. It can cause it to have a seizure. It can cause heart attacks. And that's a serious risk. So we never get anyone to stop. It must always be done in a controlled way, and we must always do it very slowly and under clinical supervision. Somebody may end up in financial problems because, again, they're prioritizing their substance over their day-to-day living. And again, I get people say to me, oh, that doesn't happen if I'm on my computer. Well, it does if you're not going to work. It does if you're up late at night and you're not being able to function the next day. It does if you're prioritizing your gaming and you're not doing your schoolwork. That absolutely is the definition of a problem. You may have legal problems. So legal problems might be the fact that you're making poor choices. So you're driving whilst under the influence of drugs or alcohol. You may end up with antisocial behaviour orders because of drugs and alcohol. You may end up being barred from places because of drugs and alcohol. And finally there, you may have relationship problems. So this is where your partner's telling you, look, I want you to stop. You end up in conflicts. And this misuse of the substance is causing a strain. So it's important to note that not everyone who misuses substance will exhibit these behaviours. You can have some people that's called functioning, meaning they're so used to the substance that actually it would be very hard to identify, and they just carry on their lives as normal. So how is it then assessed? What do we do? So again, we use the DSM-5 criteria or the ICD-11 criteria. So the DSM-5 criteria for substance use disorders looks at symptoms that are grouped into 4 categories, and that looks around impaired control, social impairment, risky use, and pharmacological criteria. So this can include things like taking the substance for large amounts or long periods of time, being unable to cut down or stop, spending a significant amount of time obtaining, using, and recovering, craving, the desire, continuing to use the substance despite negative consequences, giving up or reducing important activities to use the substance, using the substance in situations where there are physical hazards, continual use of substance despite knowing it causes physical or psychological problems, development of tolerance to that substance, so you just keep experiencing it, it keeps going up, withdrawal when you stop taking it, or using more of the substance to achieve the desired outcome. So that's the DSM-5 criteria. Under the ICD-11 criteria, you're looking at substance use disorders similar to those that we've just talked about. And again, it looks at assessment of the substance disorder use, typically involved in the evaluation. And then again, mental health professionals will evaluate that. And there are different assessment tools. So if you Google assessment tools for alcohol, there are screening tools that you can use for alcohol. There are screening tools that you can use for drugs. There are screening tools that you can use for gaming. So again, if you want to do some screening, you absolutely can. Part of the treatment for this, and one of the things that I read in a handbook last year, was about being honest and frank with people. So we have to be, when we talk about this, we have to talk about risk and we have to talk about consequence. And that's difficult because nobody wants to hear it. So it's a brave conversation to have. However, we need to be honest around what they're doing and how that behavior affects themselves and others. But if you want to manage this in a natural way, there are no single natural ways to treat this. However, in conjunction with evidence-based treatment that looks at a recovery model, you may include things like exercise. So physical exercise can reduce stress, improve mood, and promote overall well-being. There might be some mindfulness, some meditation there. And again, that will look at reducing your stress levels and help promote emotional regulation. Because again, through these substances, you end up with a process called emotional numbing, and therefore this mindfulness piece can work really well. Yoga can work. Again, that's because of breathing and the mindfulness piece, and that helps the recovery. There's some evidence about acupuncture working and around nutritional therapy. There are some other things that you can do, emotional freedom techniques, so tapping, doing some mantras, saying, you know, I'm strong, I'm able to do this, I can get through this. You may find EMDR, so again, following this, which is helping to reprogram maybe some of the trauma and deal with some of the issues why people are drinking. Or alternatively, there may be some cognitive behavior therapy there, or dialect behavior therapy to help manage some of that substance misuse. Normally there's a wellness recovery action plan, some kind of RAP model around this, or a STAR model, or an outcome STAR model of recovery. So there's lots of different things that can be done to support, but it should always be done with supervision. So let's just say you're trying, you've done the natural way, it's not working, and you put your hands up and say, look, I need help. In most towns now, there are substance misuse services, and they can be services like Change, Grow, Live. They could be services driven through the NHS. There are online services where you can do free online services for substance misuse. And getting yourself in a group, AA groups, is really important to have that network around you. And a lot of the patients that I've spoken to in the past who have recovered a lot through that group support. Equally, it may be prescribed, you can have something like methadone or something just to help take you off those withdrawals and reduce those symptoms and cravings. So again, it would be short-term use, and there may be some pieces of work around managing your mood disorder. So there could be work around your mental health, there might be a piece around anxiety, and there might be a piece around sleep. It's important to note that medication will be used in conjunction with evidence-based practices, and it will only be given if you are engaging with the services. If you stop engaging, 95% of the services will withdraw. Now, it's important to say that not all services fit everyone. There are services out there that are for women only, for men only, for young people. So when you do your research, Google what it is you're looking for, and I guarantee you will find something. If you are struggling, there's a wonderful website called the Hub of Hope, sorry. And the Hub of Hope is the UK's first national database of mental health services. So if you are struggling to find something, just Google www.hubofhope, and you will find some services there to help manage your addictions. There are also gaming clinics now, so there are also services to help people come off their IT and electronic devices as well. So it is a combination of services here. So let's go back. So what is a substance misuse? It's when we prioritize that substance above everything else. We're making poor choices, we're prioritizing it, and we're not listening we're using that substance regardless. What causes it? We covered that. Lots of stresses, lots of triggers, could be genetics, could be phenotypes. So again, it could be heavily linked to ADHD. People with ADHD have quite an addictive personality. And again, related to ODD and all of those kind of disorders there. Risk factors then, poor choice making, generally could end up in illegal behavior, driving cars under the influence, and liver. Signs, withdrawal, weight loss, self-neglect. How's it assessed? The DSM-5 criteria that we talked about, the ICD-11 criteria, and there are online screening tools. So if you're not sure, you can Google these online screening tools, you will find them. How's it treated? Exercise, good diet, support groups. You know, you may need high doses of vitamin D, vitamin Bs. And again, the doctors can prescribe you those vitamins to help. And again, some liver repair stuff. And if you need medication, things like methadone or any of those patches and stuff that you need to help manage the detox, that'll be prescribed for through specialist services. And normally your GP will refer you to those specialist services. And it's all about engagement. And what I would say is I've done a lot of work with alcohol and substance misuse services. They do a fantastic job. They are all overstretched. So therefore, they really want to work with the people that are ready for recovery, those that want to do it. And if you're being referred by the GP, it's a bit of a warning signal. Are you ready for recovery, or are you being forced into this? So you need to make sure that you are ready for recovery. And alongside that, it's important to think about what got you there in the first place. So when you reduce this alcohol, when you reduce this substance, when you come back to the real world where emotional numbness has taken place, you'll need to think about, how am I going to manage what got me there in the first place? So do you have counselling lined up? Have you got cognitive behaviour lined up? And have you learned new coping skills or new resilience skills? My name's Steve. I'm the mental health nurse, and I hope you found that session useful. Take care, everyone. Bye for now.